and welcome to What Would Larry Do? I am Dr. Ann, and I am here with Larry Hellwig.
Hello, everyone.
Good afternoon.
Good afternoon.
It's sunny Phoenix.
It is.
I have to say, in a couple of our podcasts, it was too hot and we were sweating to death. And this time of year, it is absolutely amazing, and the rest of the world is freezing to death.
Yes, so Phoenix is the place to be right now.
Mm-hmm.
Gorgeous.
Yep. I want to say it's like high 70s here.
Yep. A gorgeous, beautiful day.
Mm-hmm.
And it's a Monday.
Which is not our usual, so both of us are a little low functioning. It's not only a Monday, it's an afternoon.
It's a Monday afternoon.
We're usually doing this on like Friday mornings when we're excited because it's
Yep.
Friday.
Yep.
You know, we're all awake.
Getting ready for happy hour
I know.
weekend.
To be honest, we should have done this one as a happy hour.
Would have been good.
I know. It's 4:30 right now. We could have been drinking cocktails.
We
while
have
we're here.
never done a podcast or an event with alcohol.
Well, I don't know about an event. I think we've had alcohol at our events.
Well, we've had lots of events with alcohol. That's true.
But we have never done a podcast. We're gonna have to experiment with that one of these days. All right. Well,
Could be interesting.
I think it would be a lot of fun.
Yeah, it would.
All right, to get us back on track before we're totally down a path that we're not going to come back from, we're going to talk about the Moxi today. So, Larry, tell me a little bit about what is Moxi, or who is Moxi?
It's wonderful. I mean, what else?
All right, come on.
Okay, so there are a lot of different lasers, and Sciton has a lot of stuff in the works all the time. And they've come out with a device called Moxi, and we've used it. I've had 3.
And I've had 2.
You've had 2.
Mm-hmm.
And a few other people in the office have had, 2 or whatever, and everyone loves it. So, I mean, we'll get into the details of it in just a second, but if you think about a halo, which we've talked about, and has been around for a long time, has a great reputation. It's one of the most highly sought out treatments that you can get, and success-wise regarded as just kind of a home run.
Mm-hmm.
And this is like its little brother.
Yeah.
Because it functions in a very similar way. Is it as aggressive? No. Does it go as deep? No. None of those things, but it is so simple, it is clean, and you can pick and choose, how aggressive you want.
Yeah.
Love this treatment. I mean, again, I had 3 of them, loved every single one, and I love what it does to the tissue. I think, in fact, I changed a consult today in which a lot of times we'll do certain treatments, and, you go into this mode of maintenance that we don't call maintenance. We call it enhancement. But you're doing correction first. And so you do things that will correct. Now, would this device correct? Yes, I think it will correct. But as far as where I like it is you maybe did some microneedling RF, you maybe did a little resurfacing, you maybe even did a halo or something, and now you really want to just enhance the success you've had. Mm-hmm. I think that, God, this is so simple and it's so easy for patients, and we use it with exosomes, and we just got done with a skincare line that we are definitely going to incorporate more and more of that product in with what we're doing.
I'm going to mark those words. It is now recorded forever that you said we were going to do that.
Well, we're going to build it in.
Okay, good.
Yeah.
I like that.
But it's like everything we can do, and so, and we all learned a great lesson from one of our patients, and we talked about it in the very last podcast that you have not heard yet. It's not out yet, where we did talk about skincare, but we talked about a patient that's 76 years old and how great she looks, and her skin is flawless.
Yes.
Absolutely flawless. Okay, what do you do at that point? I mean, there's all kinds of little things. There's lots of good skincare, a lot of things you can do, but I like Moxi for her.
Yeah.
I think, what minimal downtime, easy treatment for her, but it just leaves your skin so refreshed. It's beautiful. So
Well,
I love
Moxi
it.
is a fractionated 1927 nanometer thulium laser. So this is going to be in that mid to far infrared range that we're going to be dealing with. So it's actually non-ablative. So that's where Larry's talking about this minimal to no downtime. So we do actually have a video that'll be coming up here soon where we are treating Larry with it.
And when you do it, we say it's non-ablative. You do get light flaking of the tissue.
You can see that video. It's just an easy, they rub the little roller over, and as it's firing that 1927 nanometer wavelength, it penetrates the skin. This is very easy and comfortable for patients to have done. Little bit of topical numbing, and that's it. So you can also see that's our laser tech Sierra doing the procedure. So this is a delegatable procedure.
Who's the good-looking patient there? Just wondering, you know.
Right? But low to no downtime. So the patients don't have a lot of recovery. Larry's right. You will get this kind of rough. Oh, there he is after post. He's got some swelling going on.
Okay, but now let's tell the story. This is the most aggressive this device will go.
Yes.
It's taking it to level 3
Yes.
and pushing everything up above that to the max. And this is immediately after.
Yes.
And we did some exosomes, and then, of course, skincare after that. But we did exosomes, and 2 hours later, no swelling, no redness, no heat, no anything.
Yes.
I mean, it was like done.
Yeah.
And so the idea for us is because we have, first of all, it's not a crazy aggressive treatment, but because we've added exosomes. So, again, stacking technologies to get a better outcome faster, right? So because we've done that, it allows us to do so much more. You could, instead of doing a real light treatment, you could do a more aggressive
Yes.
Moxie, and the patient's still back in the ball game almost immediately.
Yeah. And that's one of the benefits of it. So a couple things that Moxi is beneficial for, and one of them is uneven pigment. So you're right. You can do a real light one. We've done some light ones on me where I literally had minimal to no downtime. And then, you know, literally within 2 to 4 weeks, it's like I start getting all these compliments like, your skin looks so amazing. Your skin looks so amazing. What are you doing? And it's because I have that refreshed glow. But you can actually take it up and be a little bit more aggressive for patients who do have some stubborn pigment. You can even combine it with like a BBL or photofacial, where you do the BBL or photofacial first, and then you do the Moxi on top to really go after pigment. And there's even some who are out there that are getting fairly aggressive with Moxi in small spots to get rid of those stubborn SKs or seborrheic keratoses that are out there. So, you know, some of our favorite patients that I was talking about were their arms. I have this lovely patient. She's in her 60s or something like that. But anyways, I have tried everything on her arms, and this is going to be our next adventure with her, because Moxi is new to our practice as well, where she came in and she said, you know, I have all these spots on my arm. She said, at one point I was a cougar, but now I'm a leopard. And I want you to take care of these spots so I can go back to being a cougar. And I photofacialed her and got rid of all the simple pigment. But then she's left with some of these SKs. And this is one of the areas that Moxi can come after and use some of this uneven pigment, or go after this uneven pigmentation, not only on the face, but as well as on body, because it has that lower to no downtime. And even if we get more aggressive, it's still safe to do on the body.
And the advantage is, you know, as we age, so even if we've done correction and we've done treatments, we're still aging.
Yeah.
Things are still going to happen. And they really have 3 different settings, different programs that you can use. So obviously, in that situation, you can just go over it multiple times until you get it. You know, so that's one thing. But you have a prevent and refresh, which is the program number 1. Very simple, very easy. You just want to clean up a little bit, nice little treatment, not a big deal. People will be back in the ballgame right away.
Yeah.
It's so easy. And then the next one would be what I would call our enhancement program, where a lot of people have already been through a lot. Well, now we need to keep that going. I don't want to lose the momentum, kind of keep it going, and that's revitalize and maintain. So you can kind of jumpstart the collagen, jumpstart a lot of things with the skin, and keep them going in the direction that we want. Now, I believe the third is the one that I like. I kind of always, go big or go home. I mean, it's like, we're here, we're doing this. Why not take it up? Why not get even more out of it? And they call that the transform and renew. And every once in a while, I think somebody needs that. Everybody needs that. And so, again, you will have your skin feels like sandpaper for a couple days, and then it's gone. And in the meantime, I'm not red, I'm not swollen, it doesn't look horrible. So this is a treatment that I think somebody could have once a year, maybe even twice a year, and get quite a bit out of it, and then just do lighter things in between. So again, neck, you can do chest, you can do pretty much anywhere on the body. And we're excited about it. I think this is great technology.
Yeah, well, besides the uneven pigmentation, so it affects tone and texture. So
Yes.
your overall tone, reds, browns, just the dullness of the skin. So it brings back that glow. And I swear that's why when I do this, I always get those compliments. And you can see some of these before and afters. These patients, besides their pigment, they just look younger and better. And it's something so simple. But that texture, those pores, this is one of my favorite treatments. So Halo was always my go-to before. Now Moxie has become one of my favorites because I have a little bit less downtime with it, but it tackles the pores and the fine lines and the texture of my skin that I really hate. And then just light sun damage and aging. So again, sometimes we get patients that are in and they're new and they're a little scared to try something big, and literally combining this with a BBL and a little bit of a Moxie, it's simple for them to do. It's not painful. It won't have a lot of downtime. There's not a lot can go wrong, but they see such a huge difference in their skin that then they're like, oh my gosh, what's next? I want to do something else.
What a combination. I mean, anywhere.
Yeah.
Anywhere in the body. But I mean, that is such a strong, powerful combination to work over someone's pigment, do all that, deliver the goods. And of course, we have talked about the hero.
Yes.
So, I mean,
Yes, we have.
You can do it in motion. I mean,
Yeah.
you could do face, neck, and chest so fast and do that, and then follow with this device, at least for the face, and give that refreshed look. And you don't have to be super aggressive. You can do the photofacial and then follow with this and have that as your treatment package. And that's something, they could do twice a year or 3 times a year in a nice little enhancement type program, enhancing the correction you've already made. So they just keep getting better and better over time, very much like our 76-year-old that came in.
Yes.
She just looks fantastic. And we have other patients like that too, where it's the same thing. You look at them and their skin is absolutely flawless. Well, what are you going to do now? Well,
Enhancement.
That's right. You're going to enhance, because the minute you stop, of course, things are going to start to change.
Yes.
And so just keeping a program going so that they continue to get younger and healthier and more just revitalized skin, yeah, of course. That's the way to go.
Yep.
Yeah.
Well, and something else I would like to bring up about Moxie is that it is safe for all skin types. So we can treat melasma and PIH with it, which they will pop up a before and after of a Fitzpatrick 6 skin type. This can be sometimes scary for people to treat because they're not as comfortable with the skin type. With other lasers, you have to worry about hyper and hypopigmentation. But this is one of those fractionated lasers that is safe to treat on all skin types. So it doesn't matter what the demographic is of your practice. It doesn't matter if you're seeing melasma, seeing PIH, seeing sun damage in a Fitzpatrick 2. You can treat pretty much anybody who walks through the door. So now you're not limited to just a certain population like you are with some lasers. You can treat anybody.
And if you're concerned, just start with the lower level. You've
Yes.
got 3 levels, so start where your comfort level is. Go ahead and start that way. You can always take it up next time and see how they do along the way, but everybody gets confidence that way. And, it's like the patient feels better. Yes, this is safe. I did great, that whole thing. And you do want to know that you're not hurting anyone, and that's exactly what they found. But if there is a concern, and you can delegate this procedure, so your technician can do this. And if there's a concern about your technician doing darker skin type, just go with the level 1 treatment.
Yep.
Then go to level 2 and just take it up like that. And I think everyone will gain a lot of confidence and see the results along the way.
Well, yeah, especially since darker skin types are more prone to PIH or post-inflammatory hyperpigmentation, post-injury or acne outbreaks or things like that. And a lot of times chemical peels have been the only option. And Moxi is very successful at treating that kind of pigmentation without the risk and without the heavy downtime, and can give these patients beautiful, flawless skin and get rid of their PIH.
If you're a patient and you haven't had anything, and there's millions of you out there, I'm sorry to say, but there are. And you go, well, gee, I'd like to try something. I mean, go in and get a photofacial followed by a Moxi, and that is a nice program, and it's a big program, but it's not crazy. It's like it's going to make such a change in your skin, the overall texture, the smoothness, the brightness. It's like luminescent, it just changes the reflection. It just changes everything. And so I think that a lot of people are always scared. But that's a laser. Now we're using a laser and this, and we're doing all these things and what have you. If you want somebody to come back, you can't hurt them. Number one, do
no harm.
Do no harm. They really won't come back if you hurt them. And this isn't going to hurt them. This is not one of those kind of procedures. So that's number one. Number two, you have to still be result-oriented. Nobody pays for fluff, and then they don't pay for effort. They're actually giving you hard cash. You need to have nice things happen
You
to
need
the
to
skin.
deliver results.
You have to deliver, and you need to be result oriented. And this treatment, I don't care who it is going to deliver a result that I think they're going to be happy. And you can start very conservative with it, or you can take it more middle of the road. But they're going to get to see something, and they're not going to have tremendous downtime in the process. It's huge. And so if you're out there, you've wondered, what should I do? Where do I go? Find an owner of Moxi. That would be somebody who has a Sciton. And, set up an appointment and get a consult about it and talk about it. I mean, is this something that's going to make a difference in our practice? Or is this something that's going to make a difference in my skin? Just sit down with them and let them go through it. They can show you some before and afters and go through with the protocol and all that. But I think if you take a personal and just look and say, okay, I owe something to me. I owe this to myself. And I want to go in and I want to get something done. Go in and ask for this treatment. Get a photofacial followed by a Moxi. You will not be unhappy. You're going to be very happy with the results, and you will want more of them. And that's just the way it works. That's why I like having them. I want more. And I like what it does to the skin, and I like the fact that, I'm not out of commission for weeks. It's very easy that way. And so I think on a personal level, people should be looking at, okay, I can start to change my skin and my overall look without anything horrible, without a horrible process.
The funny thing is I wonder what to you is your version of out of commission, because we have done full field erbium resurfacing on you and had you literally show up the next day at the office oozing down your face. Actually, we had an experience here at the recording studio. I can't remember if you were 3 or 4 days into it, one of the two, but I think that time it was a plasma resurfacing and you showed up here with the craziest looking face. We did not do videos back then, which is unfortunate. But the guy who was recording our podcast was like, what in the world is going on?
Yeah.
But for the normal person out there, there's no downtime. You know, you're not out of commission. Larry doesn't care. He'll go to the grocery store and scare people, hand
Yeah.
them business cards as he's oozing skin off his face.
And I'm always at the office because they sort of feel like, well, if you can do it, it's probably okay for me.
Yeah.
But you know, it's the business we're in.
Or my favorite is when you were, it was also plasma resurfacing, when you were flying home on a day 4 or 5.
Yeah, that's. I was actually flying to Las Vegas to give a talk, and my face was literally falling off while I was on the plane. I mean, chunks of tissue was falling off my face. You know, I'd look down on my shirt and there'd be a big chunk of tissue and, you know, sheets of tissue. And it's like, I was going to give a talk on this very procedure. And the idea was to show them what I look like on day 4 or whatever day it was. I think it was day 4. And my face was falling off in the process before I even got there. So when I got there, I had still some chunks of tissue left, you know, so they got to see that. They got to see all the new skin. So, but anyway, you know.
In other words, he had the entire aisle to himself because nobody on the plane wanted to sit next to him.
Well, that was the bonus, you know. In those days, it was so hard to get a space, you know, and it was like, okay, nobody.
They weren't quite sure what was going on with his face. They're like, I don't think I'm going to sit next to that guy.
No. And then I stayed overnight and I came back the next day. And so my face was actually better, but you could definitely tell that I had been through something. And so people were willing to kind of sit by me. But one lady said, okay, you got to tell me, I got to know, what did you have done? So she had actually had procedures before, and she was curious from that standpoint.
Yeah.
But you're not going to have that with Moxie.
You're not.
That's
exactly.
the thing. You know, you're not going to go through that type of thing.
Well, it's like we saw your picture post in the beginning, which really wasn't that bad. Like you were a little swollen, but overall not that big of a deal. And to be honest, once we put the exosomes on, within an hour or two, it was like nothing. Yeah. And yes, the skin will feel a little rough, and we'll want you to use a few skincare products to care for it for a few days. But there's no pain with it. You know, patients are very comfortable as they're healing over the next couple days. The skin just feels rough. People like me who are super sensitive, I do get swollen for a couple days, but it's still not anything that I would consider to be a serious downtime.
No.
So.
And, you know, I think, too, when you look at technology, if you're in office looking at technology, you need to have something that, number one, is safe. So, you know, you don't want it if it's not safe. And number 2, is it efficacious? Does it work? Mm-hmm. I mean, is this effectively doing what you want it to do? That's important. Number 3, is it cost effective? I mean, does this thing cost me $500 every time I treat? You know, no, it doesn't. There is a disposable tip for it, but it's not
inexpensive.
It's very inexpensive. And number 4, you know, if you're a physician, do you feel like, oh, I have to do all these, or is it delegatable? And it is delegatable. You can have your technicians do this procedure, and they love it. Everybody loves doing this procedure. This is an easy procedure for them to do. They can do photofacial and follow with this, or just do this, or, you know, whatever. But Sciton has a device called the M-Jewel. And it has both on the same device, on the same platform. And the photofacial is, you can do it in the standard way, which everyone has seen, but you can do it in motion, which is called Hero, which is unbelievable. And so that's a really nice thing. And then, of course, you know, having this with it gets you into
and there's a
changing.
picture of it.
Yeah.
So this is the level up of the skin where we're talking about level 1, level 2, and level 3. And that's a picture of what the M-Jewel looks like with the BBL on one side in motion and the Moxi handpiece on the other side where it includes both of those. So that's how to revitalize your business with Moxi and BBL Hero.
It's a sexy little device. It really is. It's just, it looks good. It's easy to move around, and it just does so many nice things.
This is a good time for me to pose the question for you then. So if you're a practice like us, that you already have halo or fractionated resurfacing, why do you want to add Moxie? I told you I was going to do this. So don't act surprised.
Well, I think Moxie is because it's a quicker, simpler form of halo. Mm-hmm. And I think, there's so many different levels to treating skin. Where deep resurfacing is on the far end, and maybe photofacial on the near end, and you've got a number of things in between. I look at photofacial, Moxie, combined makes it as powerful and your results as doing a halo.
Yeah.
I think that overall look is like a halo look without having a halo. Mm-hmm. And while I like halo and I appreciate halo, I just find Moxie to be simpler. We're not hooking up all the stuff. It's just easy to do.
But for some of our deeper acne, scarring, and more aggressive resurfacing type things, halo's necessary. But I agree.
Yeah.
Before we were turning down the settings for these little light halo procedures, and now you can just do a quick little Moxie.
It does offer so many advantages to the office. So the practice that already has halo, an M-Jewel, gives you an opportunity to do in-motion photofacial and Moxie in another room while doing, halo, whatever you want in room 2.
And delegatable.
Yeah.
So it's like you said, in your other room, you have your tech doing this photofacial and this light little Moxie. You can be doing a more aggressive halo or a more aggressive resurfacing next door, and you're both producing revenue at the same time.
Yeah. And it is worthwhile. It's a beautiful little device. It works, it's a game changer for your patients. But I think it's for the new patients that are just coming on board. But I also think it's for your patients where you've already done quite a bit of correction and you're just keeping them looking absolutely amazing.
Or somebody who needs a quick refresh. Like
yes.
If it's a month before a wedding, a bride, a mother of the bride, where they want something to make a difference in their skin to have that beautiful glow. This is something that's perfect and it's cost effective. So it's actually more on the affordable side as well for the patients. Yeah. So that's something that can fit into their budget where you do something like this to get them ready for an event. And I always like to do it 2 to 4 weeks before. Their skin just has that popping glow. And that's what everybody's saying. Your skin looks so good. It can be the wow factor for them where they come back and they're like, I want another one of those.
Yep. I love it for that.
I know. Me too.
So
that's what got me hooked.
Yeah, it's exciting, and everybody who's ever had it says that. It's like, look at, wow. Mm-hmm. So we love it. We appreciate it. It is relatively new. Mm-hmm. I think if you haven't looked at it, you should look at it. If you're a physician office doing aesthetics, take a look at that technology. It's well worth it. Mm-hmm. If you're a patient and you're just nervous about getting started, yes. This is your starting point. It really is. It's so easy. It's quick. It's not uncomfortable. You're going to do really well with this.
Yeah, I agree.
So,
well, good. Well, I think that pretty much wraps us up towards the end, unless you have any last words of advice for our listeners.
Well, if Santa Claus is out there, getting an M-Jewel would be nice. So Santa...
Is that what you want for Christmas?
Well, Santa,
under the
just
tree?
A little M-Jewel would be very, very nice and would do well in our clinic. And we have the use of the M-Jewel quite frequently because the Sciton guys are kind enough to allow us to, use it. But Santa, you really do, need to come through.
All right. Well, I will keep that in mind. All right. Well, thank you all for joining us today and coming to learn about Moxie. And we hope to see you next time.